So we're now doing the medical terminology of the endocrine system. If you have ever taken anatomy and physiology too, this would be a good time to review the endocrine system. Before we proceed, endocrine, endo is a prefix that means inside or within, and the word root or combining form crino and the suffix crine pertains to secretion. So this is all about organs that secrete chemicals in the form of hormones. Here is a short list of the major endocrine organs from most superior to inferior. You have the pineal gland, the hypothalamus, the pituitary, thyroid, parathyroid, thymus, adrenal, pancreas, ovary, and testis. The combining forms are, well, if you just drop the suffixes of all of those terms, whether you drop the AL, the ARI, the OID, the US, then you'll have the combining forms: pinealo, hypothalamo, pituitaro, thyroido, parathyroido, thymo. We've taken thymus before in a previous chapter. Adreno or adrenalo, you could see in the image that they are on top or superior of the kidneys, which is why they're also called suprarenal, not just adrenal, but also suprarenal. There are two sections of the adrenal gland. The cortex is adrenocortico, and the medulla is adrenomedullo. Next, we have the pancreas. The combining form is pancreato. That's unique. It's a T, not an S. And then the endocrine organs, ovary and testis, we've covered that under reproductive system. So if you recall, aside from ovario, it's also oophoro. And aside from testi, it's also orcho or orchido. So if we're talking about secretions here, which is the function of all of these glands, so it is common to use the prefixes hyper and hypo. That is, if there's increased secretion or decreased secretion of these organs. And then most often we use the suffix ism. So for example, there's, let's pick one. Hyperpituitarism, increased secretion of the pituitary hormones, and hypopituitarism, decreased secretion of the pituitary hormones. But there are many hormones secreted by this organ. In fact, the anterior pituitary alone, you have all of these hormones that you can see on the screen. Let's look at prolactin. So if you might recognize the word root lacto over there, so that pertains to milk, or the mammary glands. Here's an example of a complete word with prolactin, prolactinoma. So you could just imagine a tumor of the milk-secreting hormones of the pituitary. Next, we have the follicle-stimulating hormone and luteinizing hormone. So this FSH and LH, you'll see that oftentimes in OBGYN. These are hormones that physicians always check when you want to check for infertility. Next, we have the thyroid. So instead of always giving thyroiditis, thyroidectomy, thyroplasty, let's use a different suffix. Thyrocarcinoma, cancer of the thyroid. And then we have the adrenocorticotropic hormone. So ACTH, that is the cortex of the adrenal gland. Here is how you're going to break down that term. There are two combining forms and one suffix. And let's look at another one here, the growth hormone, the first one. Okay. So there are two disorders associated with hypersecretion and hyposecretion of the growth hormone. That's gigantism and dwarfism. Okay. Now in gigantism, there's also an associated acromegaly. You recognize the suffix megaly, which means enlargement. Acro pertains to the limbs. So for individuals who have gigantism, at a certain point when they have, when they couldn't grow vertically anymore because the epiphyses of the bones have already fused, the bones grow in width, not in length anymore. That's why they have large hands. Even the face is large. Okay? Acromegaly. I put here a cardiac hypertrophy because that's the most common cause of death in gigantism. Eventually, the heart that has been working so hard to supply the large body of blood, will get tired, just like any muscle. First it gets large, and then they will eventually suffer from cardiac failure. Next is the most common form of dwarfism, as you can see in this image. That is what we call as achondroplasia. If we break down that term, it actually means lack of development of the cartilage. And now we go to the thyroid gland and the parathyroid glands, which are found in the neck. Let's try a different suffix or combination of word parts. Thyrotoxicosis, that would be an abnormal condition of toxicity of the thyroid. Goiter is the term for an enlarged thyroid, which is seen in this image. The second image also has goiter, but also I want you to pay attention to the eyes. That is bulging eyeballs. Break down that term. X means out, ophthalm means eye, and os is pertaining to, which is often seen in hyperthyroidism. By the way, not all large thyroids or goiters are hyperthyroidism. Some goiters are actually hypothyroidism. Parathyroid, so we don't see it in this image, but there are about four glands on the side of each thyroid gland. So that's why we use the prefix para. So parathyroid adenoma is a tumor of the parathyroid gland. So the parathyroid, if you remember in anatomy, regulates calcium levels in the blood. The combining form or word root for calcium is cals or calci. So disorders include hypercalcemia, too much calcium in the blood, and hypocalcemia, a decreased level of calcium in the blood. Now, let's go back to thyroid. This is an image of someone who has Graves' disease, which is a form of hyperthyroidism. Metabolism is going really fast, and we can see here some of the clinical manifestations. And many of them are already in medical terminology, like epsophthalmos, goiter, we just gave that, diaphoresis, if you remember that from the topic of skin, dermatology, medical terminology, that's excessive sweating. Tachycardia, that is from the cardiology topic, a fast heartbeat. Oligomenorrhea, oligo means few or infrequent. Meno is month or the menstruation, and rhea is flow. So remember that from reproductive system. Next is Cushing's syndrome. So this is a disorder of the adrenal gland, and it's caused by excessive secretion of the hormone cortisol. This image shows you many medical terms in Cushing's syndrome. So let's look at a few. Osteoporosis, that's from the musculoskeletal chapter. There's also cardiac hypertrophy and the resulting hypertension, obesity, adrenal hyperplasia, abdominal striae from the dermatology chapter, the medical term for stretch marks. Because of the rapid weight gain, the skin is stretching. Amenorrhea, lack of menstrual flow. There's muscle weakness. I did not highlight that. Myasthenia is the medical term for that, if you remember from the muscular system chapter. Purpura, purple. And then finally, we have the skin ulcers. All of this. To top it all, there's also depression in Cushing syndrome. Now, who wouldn't be if you have all these signs and symptoms? Next is the pancreas, pancreato. And of course, our main disorder is diabetes mellitus. There are two types. Type 1, insulin-dependent diabetes mellitus, or IDDM, and type 2, non-insulin-dependent diabetes mellitus. There's also gestational diabetes. Gestation means pregnancy. So this is the diabetes that is diagnosed during pregnancy. Disorders when there is diabetes is an increase in blood sugar, hyperglycemia, and decrease hypoglycemia. The sugar in the blood is sometimes too high that it starts to show in urine. That's why you have their glucosuria. Complications of diabetes include disease of the nerves, disease of the vessels, disease of the retina, diabetic retinopathy, which could lead to blindness. Disease of the kidney, diabetic nephropathy. That's why they end up in dialysis. And outside of diabetes mellitus, in fact, the exact opposite is too much insulin, maybe because there is a tumor in the pancreas that increases the production of insulin. Going back to glycosuria in diabetes, so how do we check for the presence of glucose? We do a urine test, and there's actually a medical term for urine test, and that is urinalysis, the analysis of urine. So let's add a few more terms in our last slide. Adrenalectomy, we know what ectomy is. Nephronecrosis. Necrosis is a complete word. You can also break that down to necker and osis. Nephronecrosis is a condition of death of the kidney. Thymitis, inflammation of the thymus. The thymus is not just a lymphatic organ, it's also an endocrine organ because it secretes hormones. Endocrinologist, the specialist of endocrine system. Then we have another hypo and hyper here. And we have the word root cal that starts with a K. So what is low and what is high? If we go back to our periodic table, there's a K right there, and that is for potassium. Kalium is potassium. So hypokalemia and hyperkalemia are decreased and increased levels of calcium respectively. Here's another one, hypernatremia and hyponatremia. If you look at that periodic table of elements, natrium, Na, is sodium. So increased sodium in the blood and decreased sodium in the blood. We already did calci for calcium, but we can also have hypercalciuria, increased levels of calcium in urine. And then masculinization is not necessarily a medical term, but this means that there are masculinizing characteristics. So this applies to a female, a biological female that's becoming more masculine in physical characteristics, like, for example, there's hirsutism. That basically, I include that here because the endocrine organs, ovaries and testes, secrete hormones that are responsible for female and male characteristics. So any decrease or increase of those can result to defeminization, losing feminine features, which is basically masculinization, becoming more masculine, increase in hair growth, deepening of the voice, and all other features that usually appear during puberty. Okay, that's it for endocrine system. And if you have any questions, We can always look it up in our resources, or you can always email me.